I'm a retired nurse. I retired from Boswell Hospital, Boswell School of Nursing. I taught nursing. I'm from Maine. I taught at the University of Maine. I was diagnosed about 4 years ago with Alzheimer's disease. And my friends, my family, most people said, no, you don't have Alzheimer's disease. But I was diagnosed after being tested at Sun Health Research and by a private neurologist and psychiatrist. And I was put on a patch to slow down the progression of Alzheimer's. And then after a while, I got a new doctor, and he talked to me and looked at me and he said, I don't think you have Alzheimer's. I think your problem is you have too many medications, and the side effects of those medications have skewed your tests. And I said, well, what are we going to do about that? But gradually, over time, I've come to reduce my medications, and I'll tell you how. My first experience with medical marijuana was when I had severe pain in my knee due to a torn meniscus. And after not being able to sleep for a few nights, my husband rubbed my knee with a cannabis lotion. It took the pain away, right away, and stayed away that night, the next day, and the next day. And I thought, well, there's something to this medical marijuana product. So I started investigating online, in books, talking to people that use medical marijuana, and I decided to get my medical marijuana card based on my chronic pain. I have fibromyalgia, I have osteoarthritis, and I have an old motor vehicle accident injury to my spine. So all I had to do was take my records from my pain doctor, pain clinic that I go to the certifying physician for the state, and there was no question about getting my card. That was simple. I use very little marijuana. I take a capsule like every other day, every day. I use lotions. Once in a while I use an edible cookie or brownie, or I use tincture, little drops once in a while. I used to take 19 medications. Here's my medication list from CVS, all these medications. Now I take 8 medications instead of 19. And I no longer wear the Alzheimer's patch. At one point, one of my doctors said, I'm not telling you that you can't drive. I'm not taking your driver's license away from you, but I don't think you should be driving because you're on so many meds. Right that day, I stopped driving. Boy, is that a pain, you know where. That is so inconvenient. At one point, I had an appointment. My husband was working. All my friends were busy. I actually went to, you know, that Coffee Times paper you pick up in the restaurants, that little brown paper. I went there, and there was Dennis, the driver. And I called him, and I had this strange man come in his old beat-up Lincoln town car. And I paid him $15, and I had to have him drive me to the doctor. But I was that desperate not driving. But now that I'm on less medications, I'm back driving. Hallelujah. And so I want you to know, though, that marijuana is not addictive. Don't believe it, because I used marijuana for the better part of a year, and reduced my medications, but then I just gradually stopped using cannabis. I just stopped, and I didn't miss it. And I stopped all those medications, and I felt happy with my medical regime. And now I do take a capsule for pain, because I don't need to take Tylenol or any of the NSAIDs or Percocet or anything for pain. I still have chronic pain, but by using just this little bit of cannabis every day or every other day, like I said, a capsule. I've never smoked cannabis, never in my life, ever. And I don't intend to. I don't smoke. And I just use this tiny bit, and it keeps my pain under control, and I'm happy. So I need to tell you, it's not addictive. I just stopped, and I didn't miss it, and I didn't crave it, and I didn't need it. So I know it's not addictive. And another thing that people say about cannabis is that it's a gateway drug. Don't believe it. It's not true. Now, if I took 100 people and put them in a room, and I asked, how many of you have ever tried or ever used cannabis? Probably 40 or 50 people would raise their hand. And then I'd say, now how many of you have ever used or tried heroin? And probably 1 or 2 would raise their hand. The point is, out of you 40 or 50 people, 1 or 2 of you went on to use hard drugs. So the point is, you've used cannabis, but you did not go on to use hard drugs. So cannabis is not a gateway drug. Don't believe it. It's not true.
That's a great point.
Another thing that really, really bothers me about cannabis is the image that the press portrays about cannabis users. They tend to pick out the people in any gathering or crowd that look like a bunch of old hippies, like the society dropouts, non-productive people. They interviewed people who are uneducated, who don't know about medical marijuana. All they know about is getting high and having a party and having a good time. They look unkempt, they look sloppy. Instead of interviewing successful, educated people who have jobs and who are working and know what they're talking about. And why is this? Why does the press do that? It's because that's what the public wants to see and hear. That's what the public believes. That's the image that they have. And also, the AMA, the pharmaceutical companies, they put a lot of money into the press, the TV stations, the newspapers, and that's what they want to portray because it keeps money in their pocket. And so that's what they're going to keep telling us. This is what marijuana does. This is how marijuana people are. They don't want to talk to people like us who use it sensibly and for medical reasons only. They want to show it the old way. So don't believe everything you see on TV or read in the paper or magazines. Medical marijuana is a good thing, and there's so many people that it could help. As a nurse, I've seen it work for nausea for cancer patients. I was a hospice nurse for 9 years, and so many people with intractable vomiting, it works so well, but people are afraid. Myself, I was kind of afraid to tell my doctor that I was using medical marijuana, but I did tell him, and he said, I can't prescribe it, I can't recommend it, but it's okay with me. And I was surprised a couple weeks ago, I don't know if you know, your doctors, your healthcare facilities have these portals on the computer now. You can look in at your medical records, and you can make appointments and cancel appointments, and you can see all your prescriptions, all your tests and everything. These portals you can look in. So I looked in at my medical records and listed right there, medical marijuana patient. So he put that in my records, and it's there forever. And I thought, wow, that's great. All my doctors know. And nobody said anything to me. And he said, you know, it's okay with me. So it's part of my medical record. Then I do have one little story to tell you. I went to the dentist a couple days ago, and my hygienist was telling me that every year they have a dental convention. And the last 2 years, a dentist gets up and talks. He's a nationally known speaker. And he was telling them about
Crohn's.
No, the device.
Vaporizer?
The vaporizer. The Sun City moment. So he was telling the dentists and hygienists, everybody, about the use of a vaporizer instead of smoking or other ways. And so my hygienist got really excited about the vaporizer because she has a friend whose husband has Crohn's disease, and he just started smoking cannabis, but they have little children. So he's been doing it kind of in the closet because he didn't want kids if daddy smokes pot. So she went right away and told her friend, you know, there's this thing called a vaporizer. Your husband could use that and the kids wouldn't be upset or worried or telling their friends. So the next day, her friend went and got the vaporizer, and her husband loves it. It works better for his Crohn's than any other method he'd used of delivering the medical marijuana to his body. And so my hygienist and her friend are so excited about the vaporizer. So that's something else for you folks to consider. And someone here is going to tell you more about that. But I thought that was pretty exciting that I go to the dentist and they're talking about medical marijuana. The dentist is open with it, the hygienist is open with it, and it's everywhere now. My hairdresser and the hairdresser next to her, they're talking about it, and it's everywhere. And I still have several diagnoses. I have fibromyalgia, osteoarthritis. I have this old motor vehicle accident that injured my spine. I actually went through the windshield of the car. And Sjogren's, which is an autoimmune disease. Like Dr. Burns said, it suppresses your immune disease, which is autoimmune diseases is when your immunity is working overtime and attacking your body. So cannabis suppresses that and helps subdue some of the symptoms. So I take this one capsule a day or every other day, and once in a while I'll eat an edible. Sometimes I have a little tincture, and I use lotions. I love the cannabis-laced lotions and oils, and they really feel good. So I'm happy and satisfied with my medical regime. I only take 8 prescription drugs now instead of 18 or 19. And I use some of Reverend Mike's recommendations, and I plan to use more to lose weight. So I hope you have open mind and open ears and listen to some of the really good information you're going to get this afternoon. Thank you.